Mm.
Good morning to everyone. Good afternoon and good night to everybody. And first of all, I would like to greet all of you from all over the world, especially the organizers of this important conference and the participants and our guest speaker, Professor Veeranoot Nissapatorn. It is our pleasure to present you. Dr. Veeranoot is a medical doctor, graduated from Lady Hardinge Medical College in New Delhi, India. She has got a master on clinical tropical medicine from Mahidol University in Thailand. She is an associated professor at Department of Parasitology, Faculty of Medicine, University Malaya for 2 decades, and now she is working at the School of Allied Health Science, Walaiak University in Thailand. Dr. Veeranoot is the leader of the 2 international research networks, the Southeast Asia Water Team and World Union for Herbal Drug Discovery, working on infectious parasitic diseases and diagnosis. She published over 100 papers in different international journals. She is an editorial board member of a huge number of journals, and she received some merits and awards as outstanding scientist, namely Dr. Matthew Aischenler Research Award from Asia Pacific Consortium for Researchers and Educators at Guam, United States, and another award at the 9 International Scientist Awards on Engineering, Science, and Medicine in India. I'm pleased to present Professor Veeranoot Nissapatorn that will talk on plant-based drugs and vaccines for COVID-19 and Asian perspective. Thank you.
Yeah. Now. Okay. How? Is it the same? No. Yeah. Any banana? What is? It's for video. Hey, Maria. From Maria, where I can this one? I cannot connect.
Maybe you have to present here down in the screen.
Yeah, present here and then
yes, present. I think so.
But it's not come your entire screen here. But I cannot see that, you know. No. I cannot see this, no. I saw that this one is the window. No, chat applications. I want to share, but I think it's not cool.
Is it possible to have some help, please? To share the screen?
Share. Okay. The sim is not going.
You click there.
from Thailand. Yeah. Thank you for your kind introduction, Prof. Maria, the chairpersons. And first of all, I would also like to thank Prof. Ilian, the chair of the 8th International Conference on Health, and Prof. Celia, the chair of the 7th International Conference on Health, Portugal, for your kind invitations. I'm very pleased actually to share the updated information on plant-based drugs and vaccines for COVID-19 and Asian perspective. I think in this overview of my talk, we'll cover the available of the current drugs and vaccines and plant-based approach on the drug and vaccine at the same time. I think today, based on this World Health Organization, the pandemic of COVID-19, I think is one of the worst of the of the pandemic in the history of mankind. I think had caused enormous of the, what they call is about disaster related to the public health, to the economics, to the, what they call the public utility, and even in medical that reported around the world since it first started in December 2019. I think this figure can show very clear that more than 160 of confirmed cases of COVID-19 and more than 3 million cases of death that reported around the world according to these World Health Organizations. So now how we have to tackle this virus so far, and definitely drug come into our pictures. I think firstly, we're talking about the conventional medical, medicine's approach. I think that we know already that some modern medicine as a pharmacotherapy with many, different drugs, that molecules, or even biologics that have also been utilized in this, scenario. A number of existing drug molecules are also being repurposed for the management of COVID-19, with several clinical trials underway to validating on both efficacy and also safety. I think this is a repurposing approved drug so far that's for targeting SARS-CoV-2 or COVID-19. But however, this, no effective, anti-COVID medications that have been approved so far. But however, there are some of the, many of the number of the potential clinical studies that are taking place around the world to investigate how the therapeutic capacity of these antiviral drugs. I think of this, you can see that there are so many modern medicines now that have been available for treating COVID-19. And you can see that of this is a favipiravir that seems to be the most promising, particularly that can really work effectively in combination with chloroquine and also with azithromycin. My concern is that now that the drug that have been treating the COVID-19 is not just only the single one, but seems to be in the combination that seems get to be better, in the effectiveness of the medications. I think in Asia, I think when we talk anywhere in the world now, we have to come back to Asia, that they have the most notable, the second wave of COVID-19 pandemic that have been reported, particularly in India, that killing thousands of people every day since April 2021 here. But it's recently, that's very good at the same time that they have the pandemic, but also they turn out to be, they come up with the new solutions as a 2-deoxy-D-glucose, that clinical trial that have been very effective, particularly in the fast recovery of the patient that have been hospitalized, and also reduce the need of supplementary of the oxygens to on those affected patients at the same time. Yeah, I think this drug actually come back with the powder forms in the sachets, and then you can use this orally by dissolving in the waters. Yeah, this they use as adjunct therapy of corona patients developed by these Defense Research and Development Organizations in India, and have been approved for the emergency use by the country top drug controller. So this is very good news actually, that at the time that we are in the brink of the problems, is the collapse of the economies, and also with on the medical utility, but now the drug keep coming one by one. I think you talk about vaccines now. Yeah, vaccine is very important as a considerable that's global efforts that have been undertaken, okay, by the researchers around the world that to fasten the developments and manufacture of a multi-dosed vaccines against COVID-19. I think as we know that there are more than conventional vaccines that are available in the development and also productions at the cost of time that are required for the strategic fast-paced, okay, trial and better also infrastructure as well as with the large market potential. But most importantly, this is about potential health and safety issue that is the most concerns. I think these are the promising vaccines in developments that I think we know already, just like AstraZeneca is about Sinovac or Moderna, yeah, Pfizer that have been used to vaccines people around the world to prevent COVID-19. I think these are the 9 of the vaccine designs and developments, okay, that have been moving in the productions of the vaccines that are available around the ones that you can see that mRNA technology. This is the most, what they call just like promising as the new era of the, vaccinologies that they use it particularly that on the artificial mRNA of the deadly virus that code on the antigenic proteins of the SARS-CoV-2. And I think that this also will be something is proof that to be very effective, yeah, among all the vaccines available in the world. I think with these mass vaccinations around the world, these are the top 10 of the vaccines available, okay, that used to fight against the virus that I also feel a few that I mentioned to you in the previous slide. Next please. So these vaccines actually are commercially available, approved in different countries. And then next one, yeah, this is approved, okay, in different countries. I think in Asia, particularly Sinovac. I think thanks to China. China really produced this Sinovac and not just only, given to its own people, but also at the same time has been donated, okay, to many places around the world. That's including Southeast Asia and even in Thailand. Yeah. I think of this, you can see that on the vaccine comparisons, right? mRNA COVID-19 vaccines are highly effective in preventing infections in real world conditions. Yeah. But I think as a matter of fact, I think we know already that vaccine actually is not 100% prevention. Yeah. But one of the things that have been reported that by giving, vaccinations that can be really reduce the severity of the disease at the same time. I think these also are ongoing vaccines and antibody that currently under clinical trial of COVID-19. And you can see that mainly are produced from America. But I think it's very fortunate that few of the country in Asia also come up with its own vaccines. First and foremost, that from China, from India, that also have been vaccinating its people, okay, during this time, and Israel, and even in Thailand. I think Thailand now is our university, our premier university, Chulalongkorn, that had been, in collaboration with University of Pennsylvania, USA, that has been considerable making progress of mRNA vaccines, COVID-19, and that we hope also that these vaccines can be materialized, okay, as emergency uses by this year end. I think getting the right vaccines, okay, you're talking about mix and match vaccine is good. There is a good and bad and uncertain of the mix and match vaccine, but getting the right vaccines to the right people at the right time, I think is very logical challenge at the same time. Yeah, I think by mixing the vaccines that they think is very good point that overcome the multiple vaccines challenge at once, and there is, but still is a subject of debates in these real world situations, and it poses a big questions that left to be seen in the future. So what are reasons behind that? Why is the mix and match vaccines that they really, proposes in this time of the crisis on the, pandemic of the COVID COVID-19. I think that one of the things that they think is offer a better chance for the booster vaccines, yeah, and at the same time that you might help, get people fully, vaccinated faster, okay, by doing this mixings and matchings, of the vaccines. Then, and moreover, that mixing the two different, vaccines actually can do a better jobs, yeah, and moreover, it's better in the sense that maybe better than the only one that you vaccinate the two doses at the same vaccines. Yeah. So I think it depends that maybe in the future, yeah, one of these that in Asia. Yeah, next please. China. Now, China also considering of mixing COVID-19 vaccines to boost the protection rate of the peoples. But let's see that how it's going in the future. So you can see that vaccines now, even though now is available, but also there are many challenges, okay, ahead in the near futures. And we hope that by moving forward with this kind of mixing vaccine, mix and match vaccines can get a better result for the people, okay, of the COVID-19, yeah, at the present. So I think this, Japan. I think Japan that is one of the Asian country that's a bit, have very cautious about the vaccines that are available, okay, in this world just because of the potential of the, side effects. But however, I think Japan also set to accelerate COVID-19 vaccines program for elderly. I think in the morning I saw the, video that now that they are move forwards and encouraging on the, elderly people to come for the vaccinations, and then have this kind of collaboration between the medical personnel that can go and vaccinate people in Japan, where I think can very encouraging in that sense that now vaccine really can move to different age group, okay, and also that maybe this can create more as a herd immunity in the near futures. I think you talk about on this about the drugs, okay, about the vaccines. I think it's moving. It's moving. It's very promising. But one of the latest technology that I also very interested, and then I keep looking at a different, published article. They're talking about the potential therapeutic effect of the RNA interference and natural products. Okay, so what's happened with this therapy? Actually, is not something new. It's more than 40 years ago that have been doing, okay, but with the difference, protocol from America, that they have a direct against either the the viral proteins required during the replications and also with the transmissions. Yeah, but what happens is that it's maybe useful in the future, just because we know that by mitigating of the viral infection, the definite approach is about vaccinations, right? But because of vaccination itself, it's not last long, it's not lasting, okay? And sometimes can be just effective only for some of the people itself. So that's why that this RNAi interference may be one of the alternative that can give a new hope in order to cure the disease in the future. But however, unfortunately, there are not so many, what they call the clinical trial or even reports on this, therapy. So I think we still have some hope anyway that in the near future, that we have this new technique and also very targeting, very specific to the virus itself. So that's how we can really reduce and also remove this COVID-19 in the near futures. Now, okay, we come to the main of our point today that I really want to focus about the plant-based. I think today as a traditional or alternative complementary medicine again in popularity, and it's just like a mainstream therapy that so many countries now they use it, okay, in a variety of the healthcare setting and also as a home remedy. I think that even in South America as well as in Asia, I think we have this kind of the home remedy that's rampant in treating with different infectious diseases. I think despite of their extensive use, safety, efficacy, quality, and access and rational use of this form of healthcare, but still this is a major issue of the concerns. Why? Next. I think World Health Organizations that estimate that it's a big percentage of the world population right now that still rely on these complementary medicines to meet their health needs. And moreover, I think WHO also approved that any kind of these traditional medicines that have been available, they approve provided there is a scientifically proven traditional medicine. So this something is about the light at the end of the tunnel, that we may have a chance, okay, to produce, you know, any kind of the plant-based medicine in the near future related to COVID-19. I think World Health organizations that you know, that have acknowledged the growing needs of these herbal medicines. Yeah, I think because of the health and the wellness itself. Okay, and they can promoting or integrating traditional medicines, okay, into the practitioner and practice into health system. So usually there can be a dual system, okay, as such, that have been practices in India or even in China, okay, related to the COVID-19. I think based on the economy wise, I think that this traditional medicine is growing, and then it's become very huge for the export from Asia to countries like Australia, Canada, and UK, or even USA, and really can make an increasingly of the, you know, kind of the annual expenditures. Okay, it's a rapidly increased year by year. What's the reasons why we really come to the traditional herbal medicine? I think they should have some reasons behind. I think very commonly that we know that it's the indigenous system. It is very long time, particularly in Asians, that, you know, you're talking about Asia, you're talking about India, you're talking about China. I think they have been using on these traditional medicines for more than maybe 4,000-5,000 years ago. Yeah, okay, and then used more widely. I think we also use it and more comfortable, less costly, less side effect. That's all we know, and closely to where it needed. I think even we can grow in our backyards, okay, our homes. Yeah, it fit with the lifestyle. It's a belief and value that people serve, and it's a dual system that can be operated with cross linkages as well at the same time. So what happens with India now? I think India, they are quite, it's very common that they really use on these Indian medicinal plants, okay, against on the infectious diseases, and no exception even COVID-19. Okay, these routinely use a common Indian medicinal plants for exploring against the COVID-19. And usually I really want to show you one of the video that I received in the morning, that now they also have this an example of the mixture of the herbal formulation for the inhalations that are composed of the ginger, kalanchoe, and then you know, it's a lemongrass, it's a onions, garlic, and kaffir lambs for inhalations. I think this is one of the alternative that they're now using it to fight against the virus, that they may think that modern medicine really cannot help that much. Okay, it's not to their satisfaction. They even go and then bath with the cow dung as well. Okay, so you can see that they also try in different ways that now, you know, try to help themselves, at least to certain extent. And this also with this you know, formulation that for the inhalation, not just only for the people, just the layman, but even in the medical doctors, even on the officer, and so they do it. Okay, even in their own homes. This is also another one that when you talk about Chinese, you have to talk about the traditional Chinese medicines. Yeah, okay. This is a herb involved in the Liehua Qingwens, okay, used in a traditional Chinese medicine that to suppress the COVID-19. I think as we know already that China, actually, they are very successful in treating this COVID-19. It's mainly also because of this, you know, TCM as well. And I think that it has been approved by the government of China. And you can see that this traditional of Lingua Quinvens, actually, they use more about 13 herbs, you know, together in order to treat one disease. Yeah. But as I think we know that composition of each plant, actually they have their own property. It's a specific property for single clinical signs symptoms, okay, but one they combine together, and that's how they can cause the powerful treatments, okay, for any diseases related, okay, to the humans. Yeah. Now we come to the plant-based traditional Thai medicine. I think we also know exceptions. Okay, besides that, we depends on the modern medicine of COVID-19, but we also look back to the traditional of the, you know, Thai medicines, yeah, on the COVID-19 patients. I think these have been approved, okay, for so many years, that on the Andrographis, okay, paniculata, that we use it for the common colds and the initial stage of the COVID-19. Okay, and this also have been recommended by the doctor, but beside that they have to be under close supervision as well. Okay, so these are one of the plants that we have been using, okay, related to COVID-19. The second one has been recently published in scientific reports, yeah, and this is about finger root, yeah, finger roots, and I think is one of the chemical, that's the penduratin A, that's act as anti-SARS-CoV-2 agents, yeah, and this will be very commonly actually use it, okay, as our culinary ingredients in Thai foods, yeah, and even I also drink this finger roots tea as well, yeah. I think they also have been made as a commercial or even in the medicine white in the capsules that we can take, okay, for to cope with this COVID-19. Now come back to our teams, yeah, as I am coordinators of the World Union for Herbal Drug Discovery. I think we also let's more try to contribute to the COVID-19 in terms of that, we try to search for certain of the herbal that we think that is very benefits, okay, to COVID-19. I think this prop Mohammad Rahmatullah from Bangladesh. He's the key person actually for the COVID-19, drug discovery. That his teams and our teams that we have an initial screening of molecular docking study. Okay, that's we try to see any molecular through the computer assisted drug designs when the 3D of the structure of the target protein is available. So this phytomedicine actually is a form plant-based, has been studied to increase therapeutic value. That we think that plant-based definitely that they have a lesser side effects, okay, at the same time, and then these potent also agents can be reduce the proliferations of the COVID-19 viruses. So this is one of the published paper that we could identify this lens culinaris, okay, that's quite commonly grown, okay, in a tropical country. Next, please. The second one is about the Allium Q Sipa. This also is already in places, okay, that we're going to publish next month. This is about the onions here. So that you can see that how the herbal medicines that when they come together, that's how they can have very powerful in their potential against COVID-19. Next, please. So this is the one about the anti-malaria. I think we know that some of the chloroquines or chloroquine particularly that they have a certain of the properties against of this COVID-19, and this also we also we see that few of the chemical really work well, okay, for COVID-19, especially in 3C like protease, okay. Moreover, that Malaysian plants also have been very good as a Berchiranthus maraxensis. Okay, this is under review, and we also hope that we can publish it. Okay, because this plant not only show as an antibacterial, but also show as antiviral, particularly with the COVID-19. And this is a listed one, right? That we're doing it with Prof. Maria as well. It's about Costas alpha. Okay, that's we think that can use as a dual therapy. Okay, for the COVID-19, and maybe it's suitable in South Africa. Okay, that people are also quite familiar with only the herbal medicine as a home remedies. Yeah. And this another one as a I think it's a ginger. I think ginger can see anywhere. Actually, we also use it, okay, in our cooking, okay, and that's why it's really show the property of the SARS-CoV-2 at the area of the embryo. So you can see that there are many plants. If suppose we really go back to the original, and then we can see that they really can tell us some story. Yeah, that can help in the in the futures. And this is about the Artemisia albra that they use it, particularly in South Africa. Okay, so it's really proof that some of the phytochemical that's present in each plant, they have properties, okay, that's against COVID-19. Okay, it's support we really conduct our study and we detect it properly, okay, at the same time. So now this also another one, this the last one that we have is a Solanaceae family. This actually is about consumable vegetable, okay, that we have is a daily foods, yeah, okay, but turn out to be is very promising, okay, against COVID-19. Yeah. So you can see that there are a lot more, okay, in the process that we also try to contribute, okay, for COVID-19, pandemic, okay, that happened in this one. Now, this is one of our listed one about the research work. That is support anyone interested. Okay, you can contact us. Okay, this is about novel broad spectrum virucidal antiviral combination therapy formulations. Yeah, that we think that is very good in its synergistic ability, particularly that show effectiveness of treating and limiting the symptom related to COVID-19. Yeah, and it's a quite broad spectrum for the viral diseases also as well. That this formulation really can help in that level, and that's why they feel that this potential is the potential to be used as a traditional herbal remedies. Okay? So if anyone interested, please contact us. Yeah, at least we can have more research work and really can go to the clinical trial and can be benefits, okay, for the patients in the near futures. Now we come to plant-based vaccine. I think plant-based vaccine is the one thing that is not something new. It's very long time that they do as well. Okay, I think based on the principle that plants is commonly available. Yeah, it's quite cheap and also it's a lesser side effect. So what's happened with the plant-based actually? I think so far you can see that there are plant-based, vaccine production for humans and animal diseases. And so far, if you can observe that among all the viral diseases, plant-based vaccines also have been explored. Okay, in terms of the influenza, dengue fever, and even rabies, hepatitis, foot and mouth diseases, and even worse of the Ebola. Okay, and then the plant that they commonly use it, okay, for this, plant-based vaccine is about nicotina, it's about tobacco. Tobacco is very commonly used, okay, as a plant, as a chosen plants, okay, for the vaccines. Okay. These are how the methods, okay, the approach for the production of the plant-based vaccines, okay, that they use it for the MERS and SARS-CoV-1 vaccines, and then that's how also they improve, and then they come and use it for the SARS-CoV-2 vaccines, okay, to the different approach of the nuclear genome as genome level. So I think this is something that is very challenged, okay, and if it's happening more and more plant-based vaccines in the future, and then this will be benefit to us, and it's very good, and particularly in the in kind of the limited resource country like us, like Asia, in South Africa, and even in South America. So people can have more chances to use these vaccines, to be vaccinated, and then can be the maximum the usefulness of the plant-based vaccines. Yeah. I think plant-based vaccines and antibody to combat the COVID-19, as I mentioned, that is not something new, yeah, and they have been used already. So I just want to show about that how they use the tobacco and then other plants is in the next slides. Yeah. Okay, so this is the one. I think one of the good point when you talk since about the plants that usually it's not just only for the injectable. I think it's quite, when you talk about the invasive way, people may not be like it. Yeah. But when you talk about another way, just like the edible or even inhalations, I think maybe the plant-based can serve that purposes very well in the near futures. Yeah. Not just only they have the safe and effective, economical and rapid productions and no need for the cold storage, etc. But one of the things that is quite accessible, easily accessible, okay, through the oral immunizations, so whatever. Yeah. So this is the one thing that is really very good and very encouraging. E-support is really come into full swing of 100% efficacies of the vaccine use in the futures. Now, this is very interesting because I think one of the first country in the world that they use the plant-based vaccine, that is Canada. Canada has been developed on the plant-based under the Canadian firms Mediaco Inc. And then they have a second phase already clinical trial, even though it's not really come into use of the humans, but it's very encouraging. Yeah. And World Health Organization has listed at least 2-3 more plant-based vaccines, okay, that are however in the preclinical stage. So still it's very, it's still very initial state, but however, it's a new hope that it's supposed plant-based come into materialize in the near future, and then that will be something that we can have a new hope. It can hope for it, yeah, in the future. Next one. I think COVID-19, you can see that they have kind of the virus-like particle. They not do exactly that want to get from virus, you know, the light virus or whatever, but they try to imitate, just like imitations of that, yeah. Through the plants, but seem to be very successful because that from the Canadian firm said that it's about 100%. Okay, that they do the phase 2 trial and then seem to be very effective of the plant-based. But how the Thailand? I think Thailand also now we try to be self-producer because we think that vaccine is everywhere in the world that they really want it. So definitely that the number is not enough. Okay, it's not enough to give to everyone. But in fact, we want to give the maximum. So that's why Thailand come to the point that we also have to be a self-service, self-producer. Okay, near the finish line already in securing COVID-19 vaccines. Okay, for this. So what happens is now that you know Chulalongkorn University again, that they not just only try to produce these modern vaccines, but they also produce the plant-based vaccines, and that is about the tobacco. That tobacco not just only they use for the vaccines, but they also they do it for this rapid test for the COVID-19, for the serology, for the IgG and IgM, and seem to be very successful. For the plant-based medicine in Thailand now, we are in the first stage, okay? The first stage and the second one, the phase 2 and 3. Now, so many people now willing to be a volunteer, okay? So I think we hope that these vaccines can be in emergency use, okay? By next year at least. So just hope that something is coming on the way, yeah, okay? But can plant-based vaccines speed up production? I think so. It's about everyone keep doing, okay, and helping each other, be helping hands. I think that we can do it, yeah. Just like the Canadian said, they have nearly 100%, okay, of success in the phase 2 already. So I think phase 3 also should be not much difference, okay, in the efficacy. That's what I hope so, yeah. I think this is my last slide. I think we talked so much about this, about what's happened about COVID-19, but now we have to talk about the social impact assessment of COVID-19. I think this is an example in Thailand. So I really emphasize that this is about multi-sectorial involvement, okay, in unifying the framework of the impact of the COVID-19 to control the disease, yeah, and to the limit and cope with the economic impact. I think economic is very important because you can see now so many things are happening after COVID-19. I think that's why I feel that this is disaster, okay, of this pandemic, and people really collapse, collapse to the level that they don't have jobs, then they lost the jobs, yeah, they lose jobs, and then they cannot cope with the daily life, yeah. So this is about the public measure, and so have to come to the direct impact as well. I think since you can see that they have medical costs is already collapsed to the brink. You can see just like India, and now also we also have the second wave in Thailand as well at the same time. Yeah. So I think personal, behavioral practices is the most important. Yeah. I think that we still need to keep ourselves social distancing, and then we need to wear masks, and then we had to wash hands. I think something is the universal precautions that I think we need to keep in mind, even though we already vaccinated. Yeah. Okay. So with this, I thank you very much, and I hope that we stay home, we stay safe, and see you again in the next conference. Yeah. Thank you very much.
Thank you, Professor Veeranoot, for your excellent talk. And this talk is open for discussion. Please. There is some questions. You please can tell us. I have one question. With your experience, what is your advice concerning the role of plant extracts to overcome this problem. I mean, most of the plants we are using as fruits or legumes, we are using routinely, daily. So, which is the impact of these plants against COVID-19?
You know, I have some feeling that on the plants actually they have the properties, you know. They have the property against on the viruses and that include COVID-19. But just only that we don't have the chance to go and really pick up the ones that is the best, you know. And then we don't have the chance that to really examine on most of the promising plants, yeah. You see, just like our study, we just only can do it is just only in the dry lab, you know. We still don't have chance to go for the wet lab to really confirm it, yeah. But in fact that I think the potential of the phytochemicals are there already, you know, are there already. But just only we want to confirm it, okay? But when you talk about the plants, I'm pretty sure that so many plants in this world that have this property against COVID-19. I'm pretty sure of that. And just like our team, right? As you know already, the Mohammad Rahmatullah, he very confident. He said now he have very stronger feeling that on the plants that he have been doing, okay, through the molecular docking. I think one of these days, maybe one of the drug can be the best that can be chosen to be the drug that used to treat COVID-19 in the future. Yeah. So let's hope that something is coming. It's very materialistic, okay, and very realistic, okay, for treating COVID-19 based on the plants in the futures.
And in your point of view, what should be done more? I mean, concerning the teams, which is to go further. I mean, what can be done to go further for trials, for clinical trials as well?
I think clinical trial is very important. I think as I mentioned already that usually when you talk about international, you have to get a clinical trial. And that's also World Health Organizations recognize to that level. It's suppose you are scientifically proven through the clinical trial and then that can be accepted, okay? Can be labeled, can be commercially, so whatever in that level. But so far based on our team, I think right now we're still very initial stage. I think multidisciplinary approach in international research network or collaboration have to be further, you know, improved in order to make sure that some of the plants that we be able to rectify the phytochemical that is the very potential against COVID-19 can be further investigated, okay, in their own roles, yeah. Just like the two, the two plants from Thailand, yeah, that they really can go through these pure compounds, yeah, and then they sure that this is the one that really can help up in treating or in helping for the COVID-19 patients, yeah. So I think that we still have more rooms to go, but I think with our good hearts and our good intention, I'm pretty sure that we will meet somewhere in the near future. We will be success as a Mohammad Rahmatullah dream for, yeah, for on this, particularly docking study. I think it's really work well. Very promising.
Any questions from the audience? Please. There is no questions in the audience, but I'd like to, if you could share the take-home message. I mean, the message you can leave for all of us concerning this topic.
Okay. For me, I have this strong feeling that whatever it is, we still need to go back to the original. We need to go back to the one self. If we all really can do, just like a basic principle of the universal precautions, yeah, like we keep a social distancing, we wear masks, okay, and then we washing our hands. I think this also can help up a lot, in order to make sure that we're not going to increase the confirmed cases of COVID-19, yeah, and then we're not going to jeopardize this on the medical medical utility, because we know that on the medical facility in any hospital around the world, particularly in Asia, in South Africa, even in South America, that is really collapsed, it's collapsed for this COVID-19. So I think it's our responsibility in each one of us that we have to take it seriously. But for me, you see, even our university is quite away from the, from the area where it's become red area for COVID-19. But I still practice it every now and then. No matter where I go, I will wear mask, I will keep a social distancing. I wash my hands every time when I go to supermarkets or whatever. So I think this three part is very important. It's just our basic responsibilities to the society, not just only for ourselves, for our family, but also for the family and even to the world itself. And I think one day we will conquer this COVID-19. I think sooner or later, because I think everyone, even scientists also now keep coming and doing so many works together, okay? Both the drug and even in the modern, even in the plant-based, even in the vaccine also at the same time. So please, we join our hands here to help each other, yeah, and just practice ourselves, and then we educate on the students particularly, that they may not be really think just like what we think, yeah. But we have to educate on the younger generation as well, and even on the older generation, that they also seem never be able to take in this kind of the situations also. So we are in in a medical personnel, I think it's our responsibility to do it. So this is my home message that we have to do with oneself.
Thank you, Professor Veeranoot. It was a pleasure to listen to your talk, to listen to your advices, and thank you. And I'd like to thank all the participants as well, and to thank you once again, and to congratulate the organizers of this conference for the excellency. Thank you, and stay safe and stay well. Thank you.
Yeah, so thank you very much, Prof. Maria, Prof. Irene, and Prof. Cillian. Yeah, thank you.
Thank you.
And see you again.
See you.